today we are going to discuss about BPC 145, and we had one discussed unit 1 of block 1, introduction to counseling. Now we are going to discuss about unit 2 and 3. So first we'll discuss the unit 2, that is counseling process. So we'll see what is the objective of this unit 2 and what are the counseling processes and factors influencing counseling process and ethical guidelines. So the objective is to understand the significance of counseling, because we should know that why the counseling is done, and basic knowledge about counseling. So what are the requirement skills needed for conducting counseling sessions, and what are the different various stages of counseling process. So like counseling is not like it can be done in just in one session. It is a process which requires so many sessions, though there are some type of counseling which can be done in just one session, but further sessions also required in future. Then we will be discussing about the factors influencing the process of counseling. So you will understand the what are the different factors which affect the counseling process and ethical issues related to counseling. So let us see the counseling process. So we all know that counseling is a dynamic professional relationship. So it means it is a professional relationship established for the purpose of helping the client. There is no other purpose. So that's why it is called professional relationship. It is not an emotional relationship. It is not an overwhelmed type of relationship where the counselor and counselee both are engaged in so many different things. No, it is a professional relationship, and the objective is clear cut to help the client. So no other relationship can be allowed. So it follows a predefined path and is well structured. So counseling doesn't mean कि whenever someone asks and you start doing counseling. No. If someone has shared the problem and you start doing counseling, this is not the counseling. Counseling is everything should be predefined. Like the problem, the number of sessions, how much time it is needed. So everything should be decided and it should be well structured. So then we call it counseling. And it is basically consists of a series of stages, like beginning stage where we initiate the counseling, middle stage, terminal stage, then follow-ups. So even though after the terminal stage, like you terminate the counseling is over, you do not just shut down the your door for the patient. Why? Because patient may require your help in future also. So some follow-up sessions are arranged, and realistic goals are established and achieved. So let us see these things in detail. So stages of counseling are not discrete but continuing simultaneously. It doesn't mean that beginning stage is completed, so now you have to go to middle stage or terminal stage. No. Sometimes it goes simultaneously, and it is a developmental process. We all know that there are so many dynamics happens during the counseling session, so we have to look into that also. And client counselor relationship is basically unique in terms of attitude, beliefs, characteristics, and background of the client and counselor. So, what is unique in terms of attitude? Because the unique in terms of attitude, like the counselor is basically going to help the client, and client is seeking help from the counselor. Then certain beliefs, characteristics of the client or counselor, which we are going to discuss in detail in later few slides, and it also helps in changing the attitude of clients to gain better control over their life. So it's not like just removing the problem or overcoming the problem. It is also like uh, counselor's job is to change the attitude of client so that the client can have better control over their life, behavior, beliefs, etc. So, what is the importance of counseling process? It is very important because it helps in better decision making. So sometimes clients are not very clear what they are going to do or how they are going to solve the problem or what is the problem actually. Sometimes they are not very clear what's the problem. So it's helping them in decision making and problem solving. Okay. So what happens sometimes they know that okay, they have to solve this problem, but they are not able to take the decision. So counseling help them in taking decision. Counseling also increases self-confidence in the client, and this self-confidence is not overconfidence. It is based on the realistic evidences. So during the interview, counselor get so many information about the client, and those information help the counselor to to instill self-confidence, to instill hope in the patient. It also helps in adopting intrapersonal skills and interpersonal skills. So sometimes, like there is a lack of skill or deficits of interpersonal skills or intrapersonal skills. So counseling help in adopting such skills. It also helping in defining career goals. Sometimes they need career counseling, so counseling help them in deciding the goals, and it also help in building insight among the client. So what happens sometimes clients are not very clear. They are not able to observe themselves. They are not able to find that what type of skill defense mechanisms they are using, what type of behavior they are doing which they are not aware, what type of impulses they are having. So it also gives them insight about their internal and external behavior. So it helps a lot if they are in the counseling. Now let us see what are the various stages of counseling. Rapport establishment. So we all know that without establishing rapport, we cannot do assessment, we cannot do intervention, we cannot do any type of counseling. And we all know that before starting counseling, we should have some data, some information about the patient, which comes through assessment. So, but to assess or to interact with the patient, we need to establish rapport with the client. So, how the rapport can be established? So, we'll discuss about like there are various qualities of the client, therapist, or counselor which help in a rapport establishment. But counselor should show the concern for the client. Okay, otherwise it will be very difficult for the establishing rapport. Counselor should not be very inquisitive or very dominant. Okay, clients counselor should pay respect to the client, should patiently understand or try to listen the problem of the client. So all these things helps in establishing rapport, showing concern. Another thing is like talking about the neutral things. Do not just start about the problem. So neutral talk doesn't mean you are talking about the weather, you are talking about the politics. No. Neutral talk means you are not talking directly about the problem, you are first inquiring about the other things. For example, how you have reached here, whether any difficulty in reaching, finding out this place, okay, who are there in your family, what they are doing, okay, that sort of things can be asked. And if that suppose the client is married and having children, so you can ask about the children, how they are doing, how they are performing, or how they spend time, like that. So such type of questions can be asked with the concern related to the client. So it helps the counselor in establishing rapport. Then second stage is, as we are again going to discuss these things into detail, understanding and assessing client's problem. So it means first you have to understand and assess the client's problem. What happens? Most of the people think counseling means you you are just going to give advice. Counselor's main job is to give advice. No, this is myth. Okay, it is not advice. It is not just guidance. Counseling is little higher process than just guiding or advising someone. Okay, so without understanding or without assessing the client's problem, counselor cannot do counseling. It's impossible because you have not understood the client. So what you are going to discuss with the client? So the first goal of the first stage of the counseling is to understand and assess client's problem. Then another stage is diagnostic formulation. Like when you had lots of information, history taking, you have done everything, and then you have done mental status examination in case of psychiatric disorders, or in case of some other problems, you have to chart out what are the factors which are helping the uh, helping in understanding the problem. So those factors come under diagnostics formulation. We'll discuss in detail. Then you have to set goals and selecting and applying counseling strategies, and termination then follows. So these are the steps. Let us discuss in little bit detail. So as I told you, relationship building between client and counselor is called rapport establishment. It is based on mutual trust and respect. It means you are not doubting whatever patient is saying, whatever client is saying, you are not doubting. Okay, you do not inquire or you do not try to find out the fact. This is not the job of counselor. You have to trust. Whatever information is given to you, you have to trust and show respect for those ideas or thoughts which client has shared. Suppose the client is saying कि family members are like abusing or beating adolescents says. So we accept this, we respect clients. Okay, though the parents may be saying that they are not beating, but this is not our job to find out they are beating or not. Our job is to understand the client. He is perceiving this, he is perceiving like that. So this is the thing. So sometimes what happens, counselor they try to find out the problem as if they are a spy or they are lawyer or they are judge. No. Okay. So we have to develop this skill how to show mutual trust and respect to client. So then open communication. So whatever communication is going between client and counselor, it must be open. So clients should not hide anything. So like if you give the environment, which we are going to discuss in the next slides, the environment is like if the environment is conducive, the client will be open. If you do not allow the client, if you are biased, if the counselor is judgmental, then the client will not be open. Then another thing is genuineness. So if the counselor is genuine, it will help in establishing rapport. Genuine means you are not doing acting with the client, you are not using different languages, you are just following what you are. Okay, you just show that you are very much concerned about the client. There is no need to show to speak such word, but you have to show the way you ask the question, the way you show your physical gestures. All these will convey this thing that you are very genuine. Then showing empathy. Showing empathy means like you are very much concerned about the client's problem and your questions are related to client's problem which help you in understanding the client's problem. So when you try to understand the client, it definitely reflected in empathy. Sometimes it's difficult to feel the client's problem. Don't worry, but think you must be aware that your whatever you are asking, it must be giving the sense in the client that you try to understand his problem. It means it is empathy. Effective communication. Again, effective communication doesn't mean you are a very good speaker, you are a very good orator. No, it is not required for the counselor. Effective communication means you should be clear what you want to say. It should not give double meaning. It should not be vague. Okay, so the clear cut message should be given to client. Okay, effective communication also include listening skills and communication skills. Okay. So then, safe, secure, and supportive environment. If the environment is not safe, if the client think that others are listening his or her talk or the conversation, so the client may not be very open. Okay. And suppose the safe means suppose the adolescent came with parents and they start beating in the session during the session. So you have to ensure all these things. No violence should happen during the session, and so it should be secure and it should be supportive for each and every person, not only for the client, for his family member also. They should also feel that okay, you are very supportive. The relationship should be trusting, like you should trust the client, and you have to maintain confidentiality. So, confidentiality means you are not going to share the information with the family members, even if the patient has not permitted you. Suppose client has shared some very personal information and said that it should not be disclosed to anyone. So you are not going to disclose this to anyone, including his family member. And if you think, this is your duty to convey this thing to the family member, then you have to get permission from the client. So this shows confidentiality. So if client think that yes, you have lots of respect for the client, the communication is open, you are genuine, you show the empathy, you try to understand the problem, you don't have any bias or myths related to the problem, and you have effective communication skills, you provide safe, secure, and supportive environment, you try to develop trusting relationship, and you maintain confidentiality. So all these things will help in establishing rapport. Let us see the second stage. This is understanding and assessing client's problem. So as I told you, without understanding, you cannot do counseling. So assessment starts like during repo formation, understanding about the problem and person facing problem. So you inquire about the once the repo is established or it has been started establishing, you start inquiring about the problem, getting information about the problem. So one thing I told you, like communication, like it should not be bombardment of the questions. The question should be open-ended. So the counselor is asking less and client is speaking more. So such that. So it will give the scope for understanding about the problem and what the problem client is facing and gathering lots of information. So there are certain skills required for assessment or understanding the problem. These skills are observational skills, interviewing skills, and history taking skills, and validation of information from different sources. So let us see these things a little bit detail. Like what is observational skills? Observational skills are like how the client came into your office or clinic, how he sat on the chair, he sat on the edge of the chair or comfortably sat. Like generally the clients, those who are uh, anxious, they sit on the edge of the chair. Or the clients, those who are relaxed, they sit comfortably. How the client is groomed, like if personal hygiene is neglected or maintained, or it is over, like makeup is too much. Okay. So all these things, like the facial expression, client looks sad, anxious, or normal, happy, or angry. So all these things you should note down while you are collecting the history. In interviewing, like you should know the interviewing skills. There are two types of skills: verbal skills and non-verbal skills. And in verbal skills, like you should know how to ask questions. In non-verbal skills, you have to show that you are very much interested in understanding the client. And history taking has several parts which we are going to discuss in detail. A collection of standard identification data. So basically, what it is, like patient's client's name, age, education, his marital status, occupation, all these things, so income, job, what type of job he or she is doing. So all these information should be collected. Then the client's counselor's job is to describe client's present problems. So as I explained in earlier class also, like there is a performer, there should be a performer which counselor should follow. So how to describe the present problem? So suppose in case of marital discord, so you get a right that the client are used to have argument with their spouse, how it started, and then how this argument affects their life. Okay, so all these things should be mentioned there. Then exploration of various aspects, for example, developmental history, medical history, educational status, etc. So generally, like the performer clinical psychologist are like it starts with chief complaints. So what are the problem the client is having? Then when this problem started, how this problem started, and since how long these problems are there. So basically we inquire about the onset of the problem, course of the problem, and total duration of the problem. And then who were the informant? The information was given by only client or his family member or friend. So all these things should be noted down. Then the counselor's job is to inquire about the chief complaints. So a detailed history should be written about the how these problems started. For example, in case of a student who is not studying well or not performing well in the class 8, so the parents may bring the child that like he is more engaged in mobile, video games, and not playing, not studying, only engaged in internet. So, so all these information related to child should be collected. Then developmental history. Under developmental history, like the how the child was born in house, in home, or in a hospital. Normal delivery was there, or cesarean delivery was there. Okay. Was there any complications? Like generally, we inquire about the prenatal, perinatal, and postnatal complications which occurred with some of the children. Then, when the child started schooling, how was his performance? How was his like scholastic performance? Was the child interested or having interest in other activity, extracurricular activities, and how is performing those activities, how the child is performing in sports activities. So all these things should come under developmental history. And under medical history, like was there any other illnesses earlier, or is there any medical problem the child or the person, the client is suffering, and educational status. This is basically covered under the identification data, financial status, and the atmosphere of the family. All these things should be recorded. Then one more thing we record here is pre-morbid personality, like before this problem, how the client was. So was there any significant difference, or it was more or less same? So all these things should be recorded. Then we integrate and arrange all the information in a sequential manner, and then we try to make the diagnosis, which is the next step. So if you do such things with open-ended question, you will get lots of information about the client, and client will get ample opportunity to speak or to narrate his problem or her problem, and it will be the like a good session having, and client will go with a good feeling. So once you have collected all the information, you have to formulate. So this is called diagnostic formulation. So on the basis of information gathered during the assessment, you make a differential diagnosis. So what is differential diagnosis? Like you think that okay, there is a possibility of depression in the child. Okay, so possibility of depression. What could be the another problem? Another problem could be like the physical abuse of the child, like parents used to beat or hit the child. Okay, so that could be differential diagnosis. Or the child is having phobia, so another diagnosis could be phobia. Or the anxiety disorder. So you have to like keep everything in mind then while you are making diagnostic formulation. Okay, so diagnostic formulation basically helps in making a plan of action for treatment or choosing a suitable therapy. So if you don't know how to make a formulation, it will be very difficult to make a diagnosis. And if you cannot make a diagnosis, you cannot plan treatment or any psychotherapy or any counseling, any technique you may not use. And this diagnostic formulation is not a permanent type of thing. You have to revise further, because sometimes during the counseling session, you get some information and which change the diagnosis or which change the formulation. So you have to be always open. If there are new informations are coming, so you have to modify the diagnosis, modify the formulation, modify your techniques, change your techniques. There is no harm. Okay, and this must be done. And sometimes we come to know that the diagnosis or the formulation we have made was not correct, so we change, we make the suitable one again. So it means diagnostic formulation is a dynamic process. It's not like one time it is done and it is final. So the fourth stage is goal setting. So goal setting means what is the goal? If the client has come with some problem, so the goal should be desired outcome, like the problem should be managed, the problem should be solved. So that desired outcome, so the desired outcome should be like discussed with the client, and okay, like if you go through the counseling session, if you go through counseling process, you will be your problem will be solved or your problem will be less. So you have to set the goal. If you don't set goal, then it will be sometimes very difficult to plan out the or decide about the particular technique of the counseling. So it is goal setting is very important to get a valid structure of the entire process of counseling. So if you do not set goal, so you like the process of counseling may not be completed. It provides direction to the process. So if you set the goal, it means you can decide what you have to do. Generate a sense of hope and motivation. So if you set the goal, it basically generates a hope in the client, and client becomes little motivated. For example, in case of addiction, if you set the goal, okay, we'll cut down smoking within uh, 10 days, and then after 10 days we review, and then we'll set a quit date. Okay, from this date onward you are not going to smoke. So if client agrees this, so we'll set this goal. So client, it like if the client develops some hope. Okay, it means I can quit. It's possible now. So the goal setting is very helpful. Sometimes neither clients nor counselors aware about the goal, but they are doing counseling. So such things should not be done. Helps in validating the outcomes. So if you set the goal, it will be useful. You can validate the outcome with that. Yes, you have achieved this goal. Okay. But the goals must be realistic, because suppose you know that okay, there is lots of problem in the family, and the child is not able to study well. So if you just focus on the child's scholastic performance, it will not be very helpful. So the goal should be like parents are saying he should study hard, he should get 90% marks, and you are also doing counseling for that. This means that this goal is not realistic. So the realistic goals mean you have to include the family members also. Sometimes you know that the child is not so bright in suppose in maths, and parents want 90% marks, child gets 60% marks. So you cannot motivate and you set the goal that okay, child should get 90% marks. No, this is not realistic goal. And if the goals are not realistic, it will demotivate the client, and sometimes counselor also. So then the counselor start blaming client. You have not done, that's why you have not achieved this goal. Stage 5 is selecting and applying counseling strategies. So plan of action is chosen and is enforced into the setting. So like what type of counseling you are going to do, what type of techniques you are going to use. So all these things should depend on theoretical and philosophical orientation of counselor. Like counselor's training is required. Suppose the counselor is not trained in psychodynamic counseling, so the counselor should not do. Counselor cannot do. The counselor is not trained in cognitive behavior counseling, so the counselor is not going to do. The counselor is not expert in family counseling. Not he had no training, so counselor should not do the family counseling. So what type of counseling will be done? It will be decided by the how theoretically the counselor is sound in those therapies, in those techniques. Okay, so for that, counselor has to read a lot. Okay, the counselor should go through some courses where the training is given. Then only theoretical and philosophical orientation of the client will become. Then skill set. Skills generally develops through training only. By reading books, it's very difficult to develop certain skills. So if you have to practice, you should have skills, and skills is developed through training. So there should be some supervisor. Under the supervisor, if you are performing counseling, you will definitely learn the skills. So there are various skills, verbal skills, non-verbal skills, then the way you talk, the way you arrange the counseling, lots of things, huh? Your personality, your theoretical knowledge about the counseling. So all sort of things basically come under skill set. Then the counselor should have insight about the problem. Okay, so if the suppose the insight is not about the problem, so it will be very difficult for the counselor to decide about the technique. Okay. Then nature of the client. What type of client is? So if so on the basis of the nature of the client also you have to decide about the technique. For example, if the client is having intellectual disability, so you can't plan psychodynamic counseling or cognitive counseling. You have to go for behavioral modification technique or applied behavioral analysis. Okay, some your technique should be based on learning theory, simple learning theory. So it will be useful for the client, and the client can achieve the goal, you can achieve the goal. Then time. How much time do you have, or how much time you can spend with the this particular client? So if you have lack of time, like you don't have enough time, you have to see so many patients, so many clients in a day, so then you have to just do psychoeducation. Okay, so educative counseling you can do rather than applying any technique, because in 5, 10, 15 minutes you cannot apply any particular technique. Coming to the sixth and termination of the counseling and then follow up. So basically, therapeutic relationship between client and counselor is not permanent. It means you have to terminate. It should not go for longer period of time, like for 5, 6 years you are doing counseling with one. No, the counseling should have some goal, and the goal should be achieved within some limited time frame. And once the goal is achieved, you have to terminate the session. So the session ends when the problem is resolved or anticipated goals are achieved. Abrupt, unexpected breaks may hamper the growth of the client. So be careful. You are not going to abruptly wind up such session. And even each and every session, when like even the session is for half an hour or 45 minutes, before ending the session, you give some scope to client to express something. For example, you ask anything else you want to share, anything else you want to ask. If nothing there, then you have to wind up. But if the question is like it will take more time, so you can say, okay, this is very important. We can discuss this in the next session. Okay, so that way it can be decided, not abruptly. Counselor should mentally prepare the client for this process. Like when you know that now you have to terminate the sessions within 2, 3 sessions, so you prepare the client that in coming 2, 3 weeks we are going to wind up because we have achieved the goal. Then you have to arrange the follow-ups. Like after termination of the session, you can ask that suppose the weekly sessions were there, so you can ask the client after a month. So monthly 2, 3 sessions can be arranged. If you are doing monthly sessions, so you can ask after 3 months. But within 3 months after the termination, a session must be fixed. So let us see what are the factors influencing counseling process. So physical setting or contextual factors, process factors, client factors, therapist or counselor factors. Let us see these factors in detail. Physical setting or contextual factors, like confidentiality and feeling of safety must be there in the client. Okay, whatever information he or she is sharing with the counselor will be kept confidential. Means the counsel is not going to share with anyone, not going to disclose the name of the client, not going to disclose the identity of the client with anyone. No universal standard is there to like what type of physical setting is there, but there must be some optimal conditions, like conducive environment is there, both client and counselor must be comfortable, like seating arrangement, good ventilation, light, right temperature, and proper light must be there. It should not, the room should not be dark or a very dim light. Such type of arrangement should not be there. The counselor's room should not be in the corner of the building where no one is going, or so it should be like some privacy is there, but it should not be secluded type of place. Shouldn't be noisy with least distractions, and presence of a table. Like generally in our country, we do counseling, and and client sit opposite to the counselor, and that table should be there in between. Whereas in abroad, in Western countries or some other countries, they use sofa or chair, and they do not use any table. But we maintain this setting. So how the counselor should sit? So the solar acronym is there, like facing the client squarely. So this is the position client counselor should sit. A little lean toward the client side. It should not be like this. The this and the open posture, like hand should not be like that. So hand should be like that, and maintain appropriate eye contact. And eye contact doesn't mean you are staring into the eye. Okay, otherwise it will make the client uncomfortable. And the counselor should be relaxed while interacting with the client. So the process factors are time limits, like time limits within a session. So it should be 30 minutes to 45 minutes. Action limit, what and how to express. Role limit, expectation from client and counselor. Like after the session, they are not going to canteen or some other places to have a coffee or tea. No, they are not going to watch movie together. Okay, like no interaction after the session or outside the clinic. Then there are procedural limits, like following demands of the procedures. So sometimes, like suppose if you are working in a hospital, so you have to do counseling during the working hour only, not after the working hour. And maintaining boundaries, like you should always remember that you are counselor and you are there to help the client. So you are not going to exploit, you are not going to maintain any other type of relationship with the client. Flexibility and the scope of changes must be there. There are certain factors related to the clients which basically affect the outcome of the sessions. So, like perception about the therapeutic relationship, preferential treatment to Georges and the literates. So, what happens? Uh, like if client is from a well-to-do family, speaks very good English, highly educated, so sometimes counselors they give preference to such client. No, for counselor, everyone is same. So what happens if client is uh, literate, or if the client is motivated to change the state, or to solve the problem. So all these things basically related to client and which help and affect the outcome. Source of the referral, suppose the client is referred by your friend, so you may give preference. No. And reluctance, if the client is reluctant, then it will be very difficult to achieve the goal. So your first job is to work on the reluctance of the client. Resistance, if the client is resistant, then again you have to work on the resistance. If client is having anger, frustration, and defensiveness, then you have to first work on these issues, then you can go for counseling. Judgmental attitude, if the client is having judgmental attitude about the counselor, for example due to gender or due to religion, if they are not from the same. Then confrontation, if the client is having the tendency of confrontation a lot, then it will be difficult to achieve the goal. And level of the insight, if the level of insight is good, the achieving goal is may, may be possible. If the level of insight is low, then it is difficult to achieve the goal. But the same way, there are certain factors attached to counselors which affect the outcome. So, personal and professional qualities of the counselor. If the counselor should be supportive, patient listener, empathic, non-judgmental attitude, positive regard, and genuine, well-trained in methods or techniques, bond to professional related ethics, self-aware, honest, then definitely the outcome will be good. But if the counselor lacks these qualities, if the counselor is not honest and sometimes gain personal benefit out of the patient, so then it will be difficult to achieve the goal. Let us see the ethical guidelines. So making decision of a moral nature about people and their interaction in the society. Normative in nature, focus on principles and standards within a profession in accordance with the client's right, regulation, and uniformity in the field, mitigating malpractices, resolution of ethical dilemmas. So it means the counselor should make the decision from moralism. So the decision should not be immoral. Okay, suppose the client is a businessman having big business, so you are not supposed to indulge in any other sort of things with the client. And the counselor should follow the norms, whatever it is, and the focus of the counselor should be on the principles and the standard set by the society of the counselor or the existing law, and the client's rights should be respected, and the client should be uh, uh, should avoid malpractice. Okay, if there is any ethical dilemma, client should discuss with the colleagues or supervisor or the seniors. So there are 5 ethical principles. Beneficence, like counselor should act in the best interest of the client. So it means whatever counselor is doing, he or she is doing for the best interest of the client. There is no other interest. Okay. Non-maleficence means doing no harm to the client. So the counselor should be aware that they are not going to do any harm to the client at conscious level. Sometimes at unconscious level they do. So they should discuss all the sessions with the supervisor in the beginning, so that the reduction of such unintentional harm be there. Then autonomy. The client's independent thinking and decision making should be respected. So client has the autonomy. You are not going to impose your thought. For example, uh, a person who is gay and disclose this thing with the in the session, during the session, so the counselor who is a religious person also thinking, no, no, this is wrong thing. So the counselor start preaching the client, no, this is like you may get HIV or this or that. Okay. No, so the client's independent thinking must be respected. Rather than preaching, the counselor's job is to help the client in decision making. Then justice provide equal and fair services to all clients, irrespective of their religion, gender, age, economic condition, social status, irrespective of everything. We have to treat clients equally. Fidelity, being honest and trustworthy with client. So some ethical standards are there, like you have before indulging the client into assessment or intervention counseling, you have to get informed consent. You take the consent ki what you are going to do with the client. You maintain confidentiality, you keep the record. What happens sometimes, people do counseling but they don't write what happened in the session. So after you finish the session, you must write what you have done. Okay, so this is called record keeping. Privacy should be there. Alleviating clients' distress and suffering. If you are not able to alleviate, you should refer the client to someone else. The counselor should have integrity, respect for human right and dignity. At any cost, the dignity of the client cannot be compromised. Professional competence should be there. If there is a lack of competence, the counselor should go for training and have some amount of competence. Self-respect and self-care. The counselor should have self-respect, and he should know how to self-care, because the dealing with certain conditions like trauma and other things may also affect the counselor. And multicultural competence, like if the client is from different culture, so the counselor should be expert in dealing those type of problem also. So let us see what we had discussed in unit 2. We had seen the significance of counseling, basic knowledge about counseling, stages of counseling process, factors influencing the process of counseling, and ethical issues in counseling. Now let us see the unit 3, assessment in counseling. So we'll see this thing, what type of assessment are there. In this unit, we will see the introduction, assessment in counseling, history of assessment, difference between assessment and testing, methods of assessment, areas of assessment, and issues in assessment. So, like the better you know the client, the better counselor you can become. So the first quality is to understand the client, and for understanding, we should know the assessment. The process, so what is assessment? So process of gathering the needed information for having a holistic knowledge about the problem, and client integrates test information with information from other sources, psychological test and objective and standardized measure of behavior. So there are various psychological tests: aptitude test, ability test, interest test, personality test, intelligence test. So basically, you see the Frank Parson, father of the guidance, was considered, and established Boston Vocational Bureau. So it is basically initiation of guidance movement, and he has written several books also. Whereas Alfred Binet and Theodore Simon in 1905, they have developed the first intelligence test, which is called Binet-Simon test. So First World War actually contributed a lot about testing, but it was basically for the soldiers. So there are various tests of interest, like strong vocational interest, inventory, Coder preference record individual, and differential aptitude test. Basically, differential aptitude test is used in career counseling. There are various personality tests, based on the Freud's theory that Inkblot. There are several Inkblot. Rorschach psychodiagnostic is one of them. Rotter's incomplete sentence blank, thematic perception test, Woodworth personal data set. There, these are the questionnaires. Minnesota multiphasic personality inventory, Milan clinical multi-axial inventory, 16PF, NeoPI. So these are the tools for personality assessment. So let us see what is the difference between assessment and test. So assessment is much broader and holistic. It includes interview and other things also, whereas test include instruments. Uses multiple methods of collecting information, whereas in test restricted to administering one or more tests. Then in assessment, collection of data from multiple sources, whereas test is collection of data only from direct sources. In assessment, both standard and non-standard methods are used, whereas in test, standard instruments only they are used. Assessments are context of assessments are usually natural, whereas tests are usually artificial and controlled. It is done in the maximum time. It is done in a clinic, and more resemblance with the real world assessment, whereas tests are less resemblance. Quantitative and qualitative data, and test generally gives quantitative measures. Necessary condition for competency to use assessment in testing in counseling. So we have to counselors have to follow the code of ethics. Instrument selection, the appropriate instrument should be selected. If the problem is related to personality, so the personality test should be selected. Conditions of administration, scoring, interpretation, diagnosis, and multicultural diversity. So the client should be expert in or trained in all those things: how to administer, how to score, how to interpret, and fetch the hypothesis from the scores. So there are two types of methods: standardized and non-standardized. As we have discussed, that in standardized methods, the process are uniform. So there is no scope of deviation, and all they are basically valid, reliable, and norms are available, and they are practical to use. Whereas in non-standardized assessment, there is no uniformity, so it is basically based on the experience of the counselor. Some of the techniques are observation, interview, diaries, and schedule, and computer assisted tests. So let us see the what are the different various tests for intelligence. So we all know that Wechsler's intelligence test is very popular. In our country, we are using Bhatia's battery of intelligence test, Binet Kamat test, and Wechsler's intelligence performance test. Also for children, we use MISIC, Malin's, that is Indian adaptation of Wechsler's test. For aptitude, like there are various tests: differential aptitude test, multi-dimensional aptitude test, battery, Thurston's examination, Sharma's mechanical aptitude test. But all these batteries are basically helping the students in deciding their aptitude and helping them in selecting the particular paper or subjects in their further classes. There are certain tools related to interest, so like strong vocational interest, blind coder occupational interest survey, self-directed search, Minnesota vocational interest inventory. So you apply these scales, you will get to know that interest of the client. As we have seen that there are personality tests, self-administered, like questionnaires, and projective tests, as we have already discussed. So for administration of projective test, you need lots of training, but for questionnaire, you need training in administration, scoring, and interpretation. There are various tests for achievements, like a standard for achievement battery, a metropolitan achievement test, Iowa test of basic skills, wide range of achievement tests, then professional oriented tests. So national teacher examination, national counselor examination, organizational achievement test. So counselors should know that all these tests like personality, aptitude, achievement, interest, all these tests should be learned by the counselor. Counselor should not say, "Oh, I don't know about this test." So the tests which are suitable in our condition, in Indian population, are must be known to the counselors. So during the training, counselors should read all the tests and practice all the tests. So at graduation level, you should at least go through all the tests in books, whatever it's written. And if you find such test in your study center, you must get issued this test and administer on your friends, so to get an idea about how these tests are done. So there are neuropsychological tests also which assess brain functioning. So in India we have BGI memory scale and an enhanced neuropsychological battery. There are foreign tests also which generally we do not use. So there are various issues in assessments, and so to summarize, we have discussed today the assessment in counseling, history, and difference between assessment and testing, methods of assessment, areas of assessment.